3,500 new IRS agents who will be hired for the sole purpose of making sure that every single person is in compliance with paying for health care. What today had been an opportunity where you could either choose to or not choose to have health care, an option today that many employers where they pay employees more money and knowing that those employees are covered under state law in case they were injured at work. Tomorrow they will be required, the employer will be required, or the individual will be required to have this coverage. Essentially what happens is that between the income of $30,000 and $90,000, there will be a subsidy that will be paid by the government. A subsidy on a sliding scale. And every single person will be required to have this insurance. You will have a form that will be provided to you or that you must have, similar to if you drive a car, that you have to have an insurance, at least liability insurance. What will happen is you must have this for every single day of the year. If you do not, and they know people will not, and that's why they've got 16,500 people, they will come and they will fine you. They've been given the authority to reach into your normal tax payments and to disrupt those payments so that Uncle Sam wins every time. I believe that this is not only unwise, I believe it is an unnecessary infringement on the lives and liberties of the American people. And I oppose this. There was the Gator Aid, and there was the Nebraska bailout. Those evidently were taken out of the bill. What has still paid in the bill are what would be called the Louisiana Purchase, which is a $300 million fund just for people who essentially live in Louisiana. There was the Dodd Clinic, which I believe was a payoff of $100 million for hospitals in Connecticut. And there was the what was called HOFA handout, which was reinsurance for unions that was put in the bill. I believe each of those are bad ideas, and once again, I strenuously object to them being in the bill, and I lost that in the Rules Committee and on the floor. CBO says it best, and they are the Congressional Budget Office. My friends that are in Democratic leadership stand up and talk about some 35 million Americans who will be covered. They fail to talk about the 23 that will not be covered. What we have done is we will lay off around 5 million people to the advantage of some 25 million, place this huge constraint not only on each and every one of you, but on the free enterprise system, which is simply designed to kill the free enterprise system so that it submits itself to the federal government. And then you will see that they don't cover everybody. Health care crisis specific causes for concern. First of all, Medicaid pays a physician 30 to 60 cents on the dollar. Second, a 2006 report says that half the doctors will start limiting their Medicaid patients. Bottom line is, there's been an independent study that's out there that up to 40% of physicians believe that they not only will not work in the system, they will retire early, which placed an incredible problem upon the system for us to be able to handle the massive amount of people who would expect to be coming. My solutions are as follows. I believe that we should not move, that we should replace what we have with a new system. I think it should be universal access for pre-existing conditions. I believe we should include tort reform. I believe we should have small business health plans. I believe we should have portability. I think we should expand the use of health savings accounts and use pre-tax dollars for all health care expenditures. If you do this alone, we would reduce the number of people who are uninsured by almost 10 million, meaning that then we could then focus on the other 10 that would need to be covered that the Democratic plan did, rather than disrupt the entire system, a $2 trillion overhaul. And I believe these represent the best opportunities. Obviously, there are lots of Republican alternatives. You've seen those as they have been presented to you. We view ourselves as an alternative party, not a loyal opposition. We are not there to say, sure, whatever you want to do. We are there to stand up for our own ideas, our ideas which we believe are good for the free enterprise system, good for seniors, and good for something that can be sustained. I now have ended my part of the presentation. I'd like to go to the gentleman, Dr. Merrill Matthews. Dr. Matthews.